I feel so fortunate to be here at CJ 800. We got such a terrific team. And just an example in the last few moments. Andrew Poplawski in the newsroom, always trying to keep us up to date, all the staff here. And 9:55, we get an email from Andrew. And Andrew's email, it's a coronavirus update. It says, the Vietnamese government has confirmed 2 cases of coronavirus. Both patients are Chinese nationals. That's 9:55. 10:13, another email from Andrew. And the email this time, Indian government reports a nurse working in Saudi Arabia has confirmed case of coronavirus infection. First reported case in Middle East. So, I'm happy that we're up to date on this stuff. But you know what? I'm not going to lie. I'm just sort of feeling just a little bit of concern. Well, researchers at the University of Saskatchewan are trying to develop a vaccine that could help address an outbreak of the coronavirus that's killed more than a dozen people in China and has infected hundreds of people. Joining me on the line, Dr. Volker Gerdts, Executive Director and CEO of VIDO-InterVac at the University of Saskatchewan. Doctor, real pleasure to talk to you this morning.
Good morning. How are you?
I'm doing well. I'll tell you this as well, Doctor. 2 weeks ago, interviewed someone, a germ expert, and we were talking about this virus and, hey, should we, the question 2 weeks ago was, should we be concerned? And the response was, you know what, we don't have human-to-human transmission yet, so we're okay. Of course, now we have the human-to-human transition, so I will ask you the same question. Doctor, are you concerned?
Well, I think there's a difference between concern and panic. Like we all are watching this right now, and we all, of course, are concerned. And as you said, it's spreading into other countries now, and there is human-to-human transmission. So, yes, we are concerned. Is there a reason for panic? No.
And so I guess the follow-up to that, if there's no reason for panic, just explain to us more, demystify what coronavirus is and why there shouldn't be a panic.
So coronaviruses are a family of viruses that we find in humans and animals, and they're known for causing these kind of outbreaks. They mutate and often jump species barriers, which means they come from animals. Here now we're thinking that it might be even coming from snakes or bats, and they find their way into another species, and then they cause these diseases. And of course, when that happens, it's a huge concern. And so the big issue there is if there is now human-to-human transmission, and the other question is, will the virus further mutate? Will it further change? Those are the issues that we need to be concerned about and that we need to watch. And as you know, WHO, the World Health Organization, just met yesterday, and that's exactly what they are looking for right now. How is this going to unfold over the next few days?
So tell me about your focus of research and study and how you enter this equation, right? You're looking at vaccines for this already?
Yeah, so we're here, the Vaccine and Infectious Disease Organization. So we're one of the largest infrastructures in the country, the research institutes focused on the development of vaccines for humans and animals. And we also have what is called a high containment facility, so a very, very secure building in which we can work with pathogens like this that require a higher level of containment. And so VIDO in its history has worked with a number of different coronaviruses. As I mentioned, they affect animals too. And we made vaccines for coronaviruses in animals. We were part of the SARS vaccine initiative. And we're currently working on MERS, which, you probably know is a close relative of this virus. So we do have some in-house experience in working with coronaviruses and have a proven track record of developing vaccines. And so this is exactly what we're doing right now. The genome of this new virus became available last week. Our Chinese colleague published it. And so now, based on that information, we have launched a project here to develop a vaccine and test it in animals within the next few weeks.
Is this eventually going to get a different name? Like, we're calling it coronavirus, but it sounds like, from what you say, it's like a generic term. So is it going to get a more specific name?
Yeah, I think there will be eventually an official name for it. I think most people, use Wuhan coronavirus at the moment because that's where it's really originated from. There's also the U.S., the CDC is talking about the N coronavirus. So there's different names for it, but, it's just once we all agree what the name should be, then that's what everybody's going to use.
We're speaking with Dr. Volker Gerdts from the University of Saskatchewan about this outbreak of the coronavirus that's led to over a dozen deaths. So are you going to get samples of this virus in your labs?
Well, that's something that we'll see. Like this project is really in partnership with the Public Health Agency of Canada. We've had lots of communication over the last few weeks. They're preparing the country. They're really focusing on strategies to control it, to contain it, so diagnostics and so on. And we're working with them together on designing vaccine strategies for it. So right now, it will go into animals. We'll test it, and then we'll hope to get some virus from either from China or from other, government agencies that are willing to share it. You can also, if that doesn't work, you can try to assemble the virus in the lab yourself, and so that's something that we're also working on. I think of note is that yesterday the Public Health Agency of Canada gave us permission to work with this virus in our facility here, and that really shows you that the government is very proactive at the moment, trying to use any capacity that there is in the country to prepare for this disease. So,
Doctor, I'm running out of time here, but I quickly need to ask you, what is the timeline for developing a vaccine? How long should a vaccine like this take?
Yeah, of course, that's what everybody wants to know. If everything goes well, we'll have it in animals for testing within 6 to 8 weeks, and then hopefully in a few months we'll have some positive results from these animals where we'll show that it works, and then it's going to take a little bit after that to get it approved for safety and so on. So really you're talking a year to maybe a year and a half.
Dr. Gerdts, a lot of great information there, and I love your tone, so please come on back on the show.
Thank you so much for having me.
That's Dr. Volker Gerdts, Executive Director and CEO of VIDO-InterVac at the University of Saskatchewan.